Hello class, my name is Totka Penn and I'm going to be talking about the proton pump inhibitor. I am in the nurse practitioner program. There are several proton pump inhibitors. Dexamethasone, rabeprazole, pantoprazole, omeprazole, lansoprazole, esomeprazole. Pharmacodynamics. They suppress gastric acid secretions by inhibiting the potassium pump, which is located on the surface area of the parietal cell. And this it inhibits the secretion of acid in the stomach. Some of the therapeutic effects are they diminish accumulation of acid in the stomach, or it diminishes the gastric acid in the gastrolumen, which lessens the esophageal reflux that can occur. It also helps with healing of the duodenal ulcers. It decreases the incidence of gastric ulcers to develop when doing NSAID therapy. It also helps with H. pylori when given with antibiotics, because H. pylori causes a range of gastrointestinal issues. Pharmacokinetics. The absorption of the proton pump inhibitors, they decrease with the absorption of food. Their distribution is kind of unknown. I tried to research it, but it said it was unknown. And they're metabolized in the liver and excreted through feces, and some are excreted through the urine. Pharmacotherapeutics. We want to use precaution with someone who has hepatic impairment. Like I said, it metabolizes in the liver. You want to also use precaution with someone who has osteoporosis, because you don't want it to get worse, because it can cause fracture of the bones. It's contraindicated. It's hypersensitive to fungicides. There's some of the adverse reactions that can occur are acid reflux or acid regurgitation, constipation, diarrhea, vitamin B12 deficiency, C. diff, hypomagnesium. Some of the drug interactions you want to pay close attention to, they can increase the toxicity to, are the antifungal agents, and anticonvulsants such as phenytoin, your benzodiazepine such as diazepam, and we really want to look at our blood medication, our clotting factors, warfarin. We really want to pay attention to that. Increase digoxin, and it can also increase the toxicity to methotrexate. Alright, indications of clinical use is basically for erosive esophagitis associated with GERD, like I said, acid reflux. It's used for treatment of the duodenal ulcers that are associated with the H. pylori. It also helps with GI bleeding, and there is a syndrome, Zollinger-Ellison syndrome, that it helps with too. Okay. The rationale, drug selection. I want to talk about the drug esomeprazole. It's usually used to treat GERD. And then I'm going to talk about omeprazole. It's used to treat heartburn and stomach ulcers, and it's also one of the drugs that is bought over the counter. It's fairly cheap, and it's a common use drug. And then we got lansoprazole, and it's used to treat the damaged esophagus. The good thing about all three of these drugs is that they can be used in children younger than 1 year old. In monitoring these drugs, you want to pay attention to the bowel function. If you have any kind of bloody stool, you want to report it as C. diff. We're going to monitor the liver enzymes. Like again, I said, those metabolize in the liver. You want to make sure you keep up with the INR and the PTT. Check for the magnesium, because hypomagnesium can occur, osteoporosis, and fractures. All right. Patient education. You want to tell your patient to avoid alcohol. You want to tell them to notify the physician of the onset of black tar stools, any type of persistent headaches, abdominal cramps, if the diarrhea develops. You definitely want to tell them to get to a physician for that. and tell them do not treat diarrhea before consulting the physician, because you want to make sure that it's not C. diff or something else going on. And for as females, you want them to notify the physician if they are planning or if they become pregnant. So I want to do a demonstration of GERD. Usually GERD occurs because the esophageal sphincter that normally keep food and acids inside the stomach stops working. It opens up and it allows the acid in the food to come back up into the esophageal. So I want to demonstrate what it looks like. And so now I'm getting ready to show you what omeprazole does. It's going to soothe the acid in the stomach. So some of the main takeaways you want to know about proton pump inhibitors is that Plavix has a black box warning with omeprazole, which I told you omeprazole is one of the common drugs that you can actually go buy over the counter. So you want to tell someone if they're taking Plavix, do not take omeprazole. Also, you want to continue your treatment for H. pylori for 8 to 12 weeks. Even after you've finished the treatment, you want to continue it for at least 8 to 12 weeks. And also, you have GERD if you have persistent acid reflux that occurs more than twice a week.